that the heat affects us in a lot of ways.
A lot of ways, no question about it.
So Dr. Art is here taking a look at something that you might not associate with heat, which I didn't, which is kidney stones.
Right.
But first we wanted to talk about some people are allergic to penicillin.
Are you allergic to penicillin?
No, and they ask, in the hospital, oh, Kimmy is.
Yeah, and they always asked you if you're allergic to penicillin, and a lot of people think they are allergic to penicillin.
Really?
But in reality, a recent study suggested that 90% of the people are not allergic to penicillin, and they ought to see their doctor and actually get tested for penicillin allergies. What often happens is you take the penicillin, you develop a rash, you might develop vomiting and feel really sick to your stomach, and so the physician naturally says, well, you have an allergy to penicillin, and we're going to stop that penicillin, we're going to give you a Z-Pak, or we're going to give you another medication. But in reality, 90% of the people who, particularly those in small children who were diagnosed maybe under the age of 10 or something like that, and they don't really have that allergy to the penicillin. So if you think you are, get tested, because penicillin is a very efficacious drug. It works really well for a lot of infections, and you don't want to really be diagnosed with an allergy to it if you don't have it.
So I just want to tell you that Kim was back there saying, confirming everything you said. She's like, yeah, I was 5. I did get a rash. So it is worth taking a look at.
Because it could have been Fifth disease or some other type of viral illness that children often get. Now let's go to kidney stones, because right now, this time of the year, kidney stones are really common because of the heat, and people aren't drinking enough water. So these are some of the things that you need to do, is keep drinking the water. Now, kidney stone often comes on. They say the pain is as severe as childbirth because it's severe. It's going to be on your side. It's going to radiate down to your groin area. You may have blood in the urine. The things that can cause it are a kidney infection and too much salt in the diet. Calcium, however, doesn't necessarily need to be reduced. In fact, it's been suggested that you take more calcium because that helps to bind with the oxalates, and the oxalates are what cause these kidney stones, and calcium oxalates are 70% of all the kidney stones that people get. Now, cola drinks, they have certain chemicals in there that actually will cause kidney stones, so be careful of those chemicals because they have those phosphates. The other thing is sweet potatoes and spinach, two really healthy foods, but they actually have a lot of oxalates, and they will cause more kidney stones than something else. The other thing, too much animal protein, because that's something that also causes kidney stones, and uric acid will increase, and that causes those kidney stones. So the things that you can do, take more water in, eliminate cola drinks, decrease the amount of salt that you're taking in, because that has a propensity to cause kidney stones. The other thing is the sweet potatoes, the spinach, those are the things. Reduce the meat, and if you're overweight, you're going to have an increased propensity to develop kidney stones as well.
Okay, and
and so these are the things. But if you start to get that pain in the side and it's radiating down to your groin, it's severe, then make sure you go to the emergency room, see your doctor. You got to get those kidney stones. It doesn't matter the size of the kidney stone. It could be a smaller kidney stone, and it's still going to be a problem. And then the final thing is acid reflux medications. And these are really common. It's Prilosec is over the counter, Acifex is over the counter. These are some medications that you will get prescribed by your doctor. It could be Protonix, all of these medications that actually help to reduce the acid in your stomach, but they can increase the risk of bone fractures, and they also increase the risk of a particular infection called Clostridium difficile, and that's something you often get as a side effect of taking a lot of antibiotics, and these medications can actually increase that risk, particularly in people who are over the age of 50, and if they're taking these medications for more than a year, then that increases the risk as well.
Okay, and so of course
so be careful of those medications.
Your number one tip is always drink plenty of water.
Drink plenty of water. That's going to help to reduce those kidney stones for sure. Right, exactly.
And you can't go wrong.
And reduce the salt in your diet.
Okay. Thank you, Dr. Art.
Welcome.
And as always, if you have questions for Dr. Art, you can always email him at askdrartmollen@gmail.com.